this is Dr. Agrawal, and I'm working as an assistant professor in Mangalam University School of Medical and Life Sciences. I have published 20 international and national reputed journal papers, and recently I have published one research article in a 16 impact factor. The journal name is Alzheimer and Dementia, and my paper was entitled like neuroprotective effect of fingolimod against AlCl3 induced experimental dementia of Alzheimer type in Vista rat. So I have published two Indian patent and I got one travel fellowship from Alzheimer Association International Conference from USA, San Diego, California. The worth was 5 lakh in INR. And I have published two international book on neurodegenerative disease. My specialization in neuroscience, neuropharmacology, movement disorder, neuropsychiatric disorder, etc. So now I'm going go through with the title of this presentation, that is neuroprotective effect of inosine against aluminium chloride induced experimental dementia of Alzheimer type in Vista rat. Basically, I have done this research in my laboratory in Mangalam University. So basically, this research was published in also two impact factor with the Journal of Neurologic Revenue. So basically, I have taken inosine drug. Uh, I have taken also one animal model. This is aluminium chloride with the Alzheimer type to induce Alzheimer type disease or the mild cognitive impairment. Yes, the next slide. So with the introduction, Alzheimer disease is an age-related disorder, basically in mainly characterized by progressive decline in a memory, and AD may be caused by the progressive accumulation and deposit of the beta amyloid. So the pathophysiological feature of brain patient with the AD includes the wall of the blood vessels associated with the different types of the abnormal filament of tau protein. So basically, if I'm going to talk about the Alzheimer disease, so Alzheimer is one of the most common neurodegenerative disorder, and 50 million people are affected from the Alzheimer disease, mainly in the USA. Basically, the sign and symptoms of the Alzheimer disease is that the loss of consciousness and the inability to speak in and further language and cognitive dysfunctions and rupture the hippocampus or the learning. So basically, if I'm talking about the risk factor are associated with the Alzheimer disease, so the one prominent and foremost risk factor, that is age. Age is one of the most prominent risk factor associated with the Alzheimer disease. Increasing age is one of the most common disorder. So basically next, high cholesterol. Increase the high cholesterol. There is a two types of cholesterol, LDL and HDL. High density lipoprotein and low density lipoprotein. So we can say that high density lipoprotein is a good cholesterol and LDL, that is low density lipoprotein, is a bad cholesterol. So basically increased level of the high cholesterol can lead to the Alzheimer disease. The third risk factor is that diabetes mellitus. And the fourth is inflammation, and the fifth is obesity and the smoking. Okay, if somebody consume the nicotine, okay, nicotine is a very poisonous element. So basically we can say that the increased level of the nicotine, definitely when it will increase, then definitely it will increase the level of atherosclerosis, and we can say that atherosclerosis is a kind of inflammation, and this inflammation can lead to the Alzheimer disease. And the last one is obesity. Being overweighted can lead to the Alzheimer disease or the sign of dementia or the mild cognitive impairments. So next slide. Again, Alzheimer disease can lead up with the neuroinflammation, environmental factors, genetic factors, mitochondrial dysfunction, and oxidative stress. We can say that in the pathophysiological role of the Alzheimer disease, due to some of the genetic factors, due to some of the environmental factors, okay, like aluminum, whatever. Okay, so induce hypoxia. Okay, first, hypoxia is a lack of oxygen. Okay, lack of oxygen. Once the hypoxia will induce, then definitely apoptosis will be happen. Apoptosis is called a programmed cell death. When apoptosis will happen, so definitely neuroinflammation will induce. After the neuroinflammation, what will happen? Blood brain barrier disruptions. Once blood brain barrier disruptions, definitely it can lead to the uh, programmed cell death and the damage of the two matter, that is gray matter and the white matter of the brain. Once the damage of the gray matter and white matter of the brain, then definitely our cerebral cortex and hippocampus will also damage. Like the after disruptions of the hippocampus and cerebral cortex, it can lead to the sign of the Alzheimer disease or the dementia. Yes, next slide. So this was the introductory part from the animal model, that is aluminium. Aluminium, basically, it is the third ubiquitous element on the earth. And basically, we can say that aluminium is used for the cooking and utensils. Uh, it is very shocked that can aluminium lead to the Alzheimer disease? Yes, absolutely, it can lead to the Alzheimer disease, because I have done in my research that I have given 175 mg per kg daily for the 35 days, and I have seen the symptoms of the Alzheimer disease by the some of the behavioral parameters like Morris Water maze and OFT, open field test, and the actophotometer and the NORT, that is novel object recognition test. So we can say that the aluminium has been shown to cause oxidative stress, induce the Alzheimer disease. Okay, and aluminium also alters the level of the ROS, that is reactive oxygen species, and the antioxidants enzymes. So we can say that aluminium accumulation in the neurons, okay, and also accumulation in the brain. Once the accumulate in the brain or the neurons, definitely it can lead to the decreased number of the oxidants. Once decrease level of the antioxidants, then definitely increase the level of the ROS, that is reactive oxygen species. Once the increase the level of ROS, definitely our cerebral cortex and hippocampus, which is major part of our brain, can also rupture in the response of the pathogenesis of Alzheimer disease. So we can say that aluminium accumulation in the hippocampus in the form of amyloid beta plaques and neurofibrillary tangle, that is NFT, which underlie the pathogenesis of the Alzheimer disease. So we can say that also hippocampus and cerebral cortex is the major part of the brain, which also can lead to the Alzheimer disease. And basically hippocampus, the function of hippocampus is the learning and memory, and cerebral cortex, the function is the to underlie the cerebral cortex or to underlie the learning and memory. So basically we can say that the hippocampus and cerebral cortex is the main part of the brain. And basically if the disturbance of the neurotransmitters like dopamine and the acetylcholine, so we can say that in the case of Alzheimer disease, the two neurotransmitters will be disturbed. One is acetylcholine and second is dopamine. In the case of Alzheimer disease, increase the level of acetylcholine and decrease the level of dopamine. Basically, dopamine is also called as a love hormone, and the function of the dopamine neurotransmitter is that reward and excitement. Okay, and if I'm talking about the acetylcholine, so acetyl nature of the acetylcholine is it is an ester of acetyl and choline. So basically these two neurotransmitter will be disturbed in the association with the Alzheimer disease. The level of acetylcholine decreases and the level of dopamine is increases. But in the case of Parkinson disease, which is also second most common neurodegenerative disorder, and 20 to 30 million people are affected from the Parkinson disease, it is also kind of dementia and the movement disorder, we can say that. So in this case, this is the opposite of the neurotransmitter disturbance. Like in the PD, Parkinson disease, if I'm talking about the Parkinson disease, in the case of the neurotransmitter, increase the level of acetylcholine and decrease the level of dopamine. But if I'm talking about the Alzheimer, in the case of Alzheimer disease, so increase the level of dopamine and decrease the level of acetylcholine. So this was the major pathophysiology of the Alzheimer disease or the mild cognitive impairment, that is dementia. So next slide, please. Now, I'm going to talk about the inosine. It is very safe and occurring purine that appears to non-toxic to human, even ingested as high 10 gram per kg per day. So we can say that inosine is widely available as supplement in health food stores. And inosine is a naturally occurring purine nucleoside formed by adenosine breakdown. And inosine also potent effect on memory and learning, possibly through its antioxidant and anti-inflammatory action, because it has a antioxidant and anti-inflammatory properties. So in the case of Alzheimer disease, means that in the case of pathogenesis of Alzheimer disease, decrease the level of oxidants, and also inflammation is happening in the Alzheimer disease. So this inosine is very protective as an antioxidant and anti-inflammatory actions. Inosine has been used recently in a small patient population for the therapy of multiple sclerosis and has been shown to have an axonal regeneration effect, either by mimicking or augmenting the effect of nerve growth factor. So in an addition report to have neuroprotective effect in various neurological disorder like multiple sclerosis and stroke, Parkinson disease, and focal brain injury. But there was no evidence on the Alzheimer disease of the inosine has a neuroprotective on a Alzheimer disease. So I have done this research on a Alzheimer disease. Yes, next. So this is the pathogenesis, and it was the hypothesis, we can say, of my research. So first, environmental factor and genetic or the hereditary can lead to the transmembrane protein amyloid precursor protein. So once APP induced in neuroinflammation, oxidative stress, excitotoxicity, disturbance in the synaptic transmission and the learning, memory, and the cognitive deficits. So in the case of neuroinflammation, also we can say that in the Alzheimer disease or in the neurodegenerative disease, what is happening? Neuroinflammation is happening, oxidative stress is happening, excitotoxicity is happening, and disturbance in the synaptic transmission or show the significant symptoms of the learning and memory or cognitive defects. But this inosine can protective as like neuroinflammation, oxidative stress, excitotoxicity, and the disturbance in synaptic transmission, and also it will help to the learning, memory, and the cognitive deficits. Because with the inducible of the aluminium, it was rupture for the oxidative stress, neuroinflammation, and excitotoxicity. But in the case of inosine, so we can say that inosine might be a protective or the neuroprotective effect against the aluminum chloride induced experimental type of dementia or the mild cognitive impairment. So we can say that inosine can lead up or can protective with the neuroinflammation, oxidative stress, excitotoxicity. Definitely this inosine will help to the neuroinflammation, and also it will help to the increase the number of antioxidants, and also decrease, inosine will also decrease the level of ROS, that is reactive oxygen species. So with the help of the beta gamma secretase, the definitely one protein, that is amyloid beta, will be happen, and it was accumulated to switch on the various pathogenic pathway like the neuroinflammation and oxidative stress, whatever, so more. So we can say that the conclusion is inosine might be a neuroprotective effect on a Alzheimer disease or the mild cognitive impairment. Yes, next slide. So we can say that the rationality and novelty of this research is that inosine has led to advance in various disease and disorder. So inosine is a metabolite of adenosine, is normally present in human, and has good safety on tolerability profile even at high doses. It has been reported to possess antidepressant, immunomodulatory, and protective action. So we can say that it has been reported to have a neuroprotective effect in various neurological disorder, including multiple sclerosis, Parkinson disease, stroke, and the focal brain injury. Further, inosine has been reported to have some enhancing effect on hearing and memory of aged rat mice, which is also one of the great prominent parameters. So inosine has been also reported that inosine used to promote the recovery of the skilled motor function in the focal brain injury or any neurological disorder. So we can say that inosine has been shown to protect against the inflammation or the cognitive dysfunctions. So we can say that the exact mechanism of action of inosine involved in the neuroprotection and in the neuromodulation are remained elusive. So thus the current study set with the specific objective to identify the therapeutic potential of inosine in cognitive disorder or mild cognitive impairment. So we can say that it is to identify the therapeutic effect of inosine in the Alzheimer disease. So this current study is designed to explore and mechanistic the neuroprotective mechanism of inosine in AD. Yes, next. So the aims and objective of this study is that the objective of this study is like to understand the effect of inosine in cognitive function and to explore the neuroprotective mechanism of inosine against aluminum chloride induced neurotoxicity in rats and to identify the effect of inosine on hippocampal neurochemistry, because I already told you two matter will be damaged, gray matter and the white matter in the Alzheimer disease, and two brain region will also rupture in the Alzheimer disease. One is cerebral cortex and one is hippocampus, which is major part of the brain. So definitely it is to understandable its association with the cognitive function. So basically we can say that definitely it might be the effect of inosine on the synaptic plasticity of the neurotransmission and the synaptic impulse with the association of the dementia or the Alzheimer. Yes, next. Next. Yes, next. Do next. 2 or 3 times. Yes, fine. Okay. So the plan of work, I have taken experimental animal, that is Vista red. The weight was approximately 150 to 200 gram. And I have taken one experimental model, that is aluminium chloride. Basically, there is a several animal model of the Alzheimer disease like streptozotocin. And we can say that streptozotocin is one of the animal model of diabetes. It can induce also the diabetes on the higher doses. But if I'm talking about the streptozotocin, in the question arises that how the streptozotocin can induce the Alzheimer or the dementia. So with the help of the ICV, that is the intracerebroventricular, so we can give the dose of 3 mg per kg daily of the STZ, and definitely it can lead to the Alzheimer disease within 10 days. So drug, I opted the drug, that is inosine. The dose was 100 to 200 mg per IP. And the standard drug I have taken donepezil. It is an anti-cholinesterase inhibitor, and I have taken the dose of 5 mg per kg per oral. So this was the 6th group: fecal control, aluminum treated, inosine per se, aluminum chloride plus inosine, aluminum chloride plus inosine, the higher doses. Okay, and the aluminum chloride plus donepezil. That is a standard drug. So we can say that the mechanism of action of the donepezil, it can lead to the inhibitory of the action of the anticholinesterase inhibitor. So I've taken the six animal in each groups. Yes, next slide. So you can see the experimental design of this research. I have taken aluminum chloride for 35 days with a dose of 175 mg per kg daily to the rat. And from the day 0 to day 35, I have taken several behavioral analysis with the day 1 or day 15 or day 30. Okay, I have done OFT, that is open field test. Just we have identified the locomotor movements in the rat. And with the day of 25 to 30, I have done Morris Water Maze. That is the test for the learning and the memory. And if I'm talking about the NORT, that is the Novel Object Recognition Test. It is also correlation with the learning and the memory of the on the 35 or 34 days. Okay. So actually, I have taken the either sex of the rats, male and female. So treatment with the inosine in every 7 days of the 100 to 200 mg per kg per IP interperitoneal. After 35 days, I have sacrificed all the animal in each group, and I have done the biochemical analysis with the antioxidants parameter or the histopathological parameters. Yes, next. So I'm talking about the results. The effect of inosine on body weight in AlCl3 treated rats. You can see the changes in the body weight. The blank column is the vehicle control, and the dot column is the inosine per se. So many of you are thinking, what is the meaning of per se? So I'm going to tell about the per se meaning is the higher dose of the drug or the inosine. Okay. So you can see the aluminium chloride. Aluminium chloride also decrease the weight of animal. You can see the decrease the weight of animal with the aluminium chloride. But the inosine 100 mg can also increase the weight of animal. So we can say that it might be protective as a weight gain. Okay, already told you in a second or third slide. So you can see the inosine with the 200 mg, it also increases, but if we can choose the standard drug, so the donepezil or the aluminum chloride, the combination will, between the enhanceable. So effect of the inosine on body weight is in AlCl3 treated value or expert has been the SEM, okay, with the scientific value of the 0.001 versus the vehicle greater than the 0.001 versus aluminum chloride. Yes, next. This was the trial for the Morris Water Maze. The memory performance in Morris Water Maze task in rats. So you can see the acquisition trial. We can say that the escape latency. Actually, I have taken the 180 diameter of the Morris Water Maze instrument, and I was hanging the camera on the top of the Morris Water Maze to just check out the activities in the Morris Water Maze. So I have filled also half tub with the water, and also put it the powder form of the milk. Okay, so the color water was white, and I have put it two pillar. Okay, so the red will move and also trying to reach on the pillar, but also with the aluminum chloride red also forgetted the memory. So it was not finding the platform. Okay, but if I was tried with the inosine treatment or the donepezil, so definitely it was finding the platform which was put it in the Morris Water Maze. So we can say that the effect of inosine on memory in Morris waterways was completion successfully with the value of the control and aluminum chloride with the protective effect of the inosine or the donepezil. Yes, next. This was the retention period of the Morris water maze same target quadrant. You can see the phenomenal changes in the some parameters like vehicle control in inosine per se and the aluminum chloride inosine 100 and 200 mg. Next. This was the locomotor activity with the instrument of open field test in AlCl3 treated rats. You can see in the vehicle control on the day first, the AlCl3 is a normal, but in the case of the 15 days, after 15 days, you can see with the rate of AlCl3 decrease the locomotor activity, but the inosine also increase the level of the locomotor activity. So we can say that the inosine might be protective in the locomotor activity as well. Yes, next. This was the spatial memory performance with the objective recognition task, same with the locomotor activity. Yes, next. Yeah, this was also the time period between the actually I have put it two platform, that is dark and the light. So just the red was finded the dark reason because it was very scared with the aluminum chloride treated rats. But in the case of the inosine, definitely it was gone through the with the light part of the object recognition, so that we can say that the aluminum chloride treated rats also scared with the uh, light reason. But we can say that the inosine or inosine treated rats also enjoying in the light reason, because it also increase the efficacy and the potency of the drug. Yes, next. So this is the lipid peroxidation. Actually, I have done the antioxidants test in a AlCl3 treated rats. You can say that the cortex part and the hippocampus, which I was already told you. Actually, I have discarded rat with the, and also uh, illuminate the two parts, that is cortex and the hippocampus. So you can see the cortex part of the aluminum chloride that is increase. Okay, but in the case of the hippocampus is also increase. Okay, the lipid peroxidation, but we don't need a lipid peroxidation increase. So we need a lipid peroxidation will also calm down. Okay, so we can say that the inosine might be protective as a lipid peroxidation. So effect on inosine on lipid peroxidation in AlCl3 treated rat was successfully done. Yes, next. Same in the case of reduced glutathione. Okay, you can see the aluminum chloride decrease the level of glutathione, and inosine also increase the level of glutathione. So we can say that definitely we need a glutathione. So inosine is doing what? Glutathione increase, but the aluminum, what does it do? This is doing only the level of the glutathione is decrease. So we can say that the inosine might be protective as a in the reduced glutathione. So all the value were expert and mean as the 0.001 with the AlCl3 or the per se with the cortex and the hippocampus part. Yes, next. This was the same catalase activity in AlCl3 treated rats. Same. Next. This is also same with the nitrite label. Yes, next. SOD, you can see in the case of inosine, the increased level of the inosine is also increasing in the part of the cortex and hippocampus, and the AlCl3 or the inosine level in the cortex and hippocampus both are differ. You can see in the bar graph of the SOD, that is increase the level of inosine per se, it is also increases, and the AlCl3 treated rats decreases in the cortex and hippocampus. But in the case of inosine 100 and 200, purses also increase the bar graph or the activity of the aluminum chloride or the inosine treated rats with the effect of the inosine on super oxide dismutase. Yes, next. So the discussion of my studies in the present study, the effect of inosine on various behavioral biochemical and neuroinflammatory changes was evaluated in the star rat, and the rat showed significant impairment of learning and memory, increased oxidative stress and pro-inflammatory. So these abnormalities were significantly attenuated by treatment with the inosine. With the some prominent parameters I have taken like Morris water maze, NORT, and the actophotometer, that is open field test, OFT, which is used as a behavioral model to assess the effect of the inosine on learning and memory of rats. These four behavioral models are widely used to evaluate the effect of drugs on learning and memory of rats. So inosine administered for every 7 days significantly improved learning and memory of aged female or male rats as compared to the vehicle treated aged rats. Yes, next. So the current study of the inosine, the MDA level increase in the hippocampus, that is SOD. and the frontal cortex of aged control rat as compared to the young control rats. So does the confirm the previous finding that the peroxidation of lipid molecule increase with the aging process? Next, the conclusion of the studies, as it is well known for a long time that inosine is an antioxidant and has been quite effective in the memory and improvement and motor dysfunctions. So with the behavioral analysis of Morris water maze test, there is a very significant decrease in the escape latency of the rats treated with the inosine, while the AlCl3 treated rats show the significant impairment in the learning in the probe trial on the 31 following, that is AlCl3. So we can say that the inosine can be treated as like a neuroprotective effect, and it is it might be a neuroprotective effect in the aluminum chloride against the dementia or the mild cognitive impairment like Alzheimer disease or any other kind of neurodegenerative disorders. Yes, next. So in the biochemical analysis, inosine treated rats showed significant increase in the antioxidants SOD like superoxide dismutase. Glutathione and catalase is observed by significant decrease is observed in the AlCl3 treated rats. So as AlCl3 significantly increased the lipid peroxidation, that is, did not show any significant improvement. But inosine 200 mg was quite effective in decreasing the lipid peroxidation, showing the dose dependent activity of the inosine. So we can say that the higher dose of inosine might be a quite effective the decreasing the lipid peroxidation or the increase the level of the antioxidants. So we can say that the inosine might be a good neuroprotective candidate for the treatment of the Alzheimer disease, and also it acts like a antioxidants. Okay, next. Thank you.